dear students, I am Dr. Anita Kahar, continuing with our topic silver amalgam. Till date, we have covered two parts of silver amalgam where we have studied about the introduction about the silver amalgam, its classification, composition, role of each and every ingredients, indications. In the second part, we have learned about the very important amalgamation reaction of low copper and high copper single compositional and admixed type of silver amalgam with its microstructure. I hope you have understood it nicely. So let us move towards the third part of today's our lecture, that is which consisting of the different properties of the silver amalgam. Today I am dealing with the two properties which are a little bit elaborative and lengthy to understand. So first one is a strength and second is dimensional change. Among dimensional changes we have to see about the delayed expansion also and the Mercuroscopic expansion also. So I am taking two properties in part 3 and in the fourth part we will be dealing with the other properties. So let us start. So according to the definition of this strength is a maximum stress a material can withstand without fracture by compressive, tensile, shear or flexural deformation. In case of dental amalgam is strong in compression and weak in tension and shear. So the thickness of the amalgam should be adequate. Otherwise, it will cause fracturing of the restoration at the thin margins. Means wherever the amalgam is thin, your restoration will fracture. So your thickness of the amalgam should be adequate to avoid the fracture. If the restoration is thin at the margin, what will happen? There will be corrosion, there will be secondary caries development, and ultimately clinical failure of the restoration can occur. So the cavity design should be proper so that it will receive maximum compressive forces and minimal tensile or shear forces. So what are the different factors that affect the strength? There are different factors. This can be asked in question, factors affecting the strength. So these are the time factors, composition of the material, mercury to alloy ratio, effect of particle size, effect of trituration and condensation pressure. So let us see these factors one by one. So the first factor is a time factor. Now in second part we have learned about the different amalgamation reaction. Now in this amalgamation reaction we have seen that once you start mixing, means once the amalgamation is started, means as you mix the amalgam alloy with the mercury, there is a formation of the different phases. First gamma 1 phase forms, then gamma 2 phase forms, and in case of high copper amalgam, eta phases also form. Now all these phases form and they grow into the crystals, and ultimately they bond with the unconsumed particles, and as the time goes on they convert it into a rigid mass, means that sets. So here as this procedure is going on, the strength is increasing with time. In about 20 minutes, the strength reaches to about 6% of its maximum strength. Now here I have written amalgam cry. Now what is this amalgam cry? This will be very helpful when you will be working on the ivory model in your preclinical conservative classes, where if you scratch the materials about after 20 minutes, you will hear one sound, that is metallic sound, and that sound is known as amalgam cram, and this time indicates that you should remove the excess of the material at that time. So that sound is amalgam cram that reaches after 20 minutes of the restoration. Now 1 hour compressive strength is important for the clinical point of view because the finishing is done in a single sitting of the restoration. And within 7 days, the strength increases at about 95%, and it may gradually after it increases very slowly for about 5 to 6 months. Now for the clinician point of view, the 8-hour strength, the 8-hour timing is very important. At this time, about 70 to 80% of the total strength is attained. Now here, why this is important? Because when you are giving restoration in patient's oral cavity, in patient's tooth cavity, you will have to instruct the patient that he don't have to use excessive masticated force for about 6 to 8 hours after the restoration, because the strength that will be achieved will not be adequate. So you will have to instruct the patient accordingly after the amalgam restoration. Now the second factor is composition. Now in composition, if you see here, high copper single composition alloy have the highest 1 hour compressive strength as compared to the low copper, spherical, lead cut or dispersed type of the alloys. It is high copper single composition alloy have the highest maximum 1 hour compressive strength. And why this is? Because if you remember the microstructure of uni composition, there is a formation of eta phase. There is a elimination of the gamma 2 phases. But here in admix also there is a formation of eta. In single composition also there is a formation of eta. But in single composition, the eta phases, how they are present? They are interlocked. They are interlocked with the matrix of gamma 1. So because of this, there is a highest strength of single composition, and because of this strength, there is an increased slip resistance to the restoration, and there is a decrease in the creep. So this is very important when you select the material, the choice of the material. Now the third factor is mercury to alloy ratio. Now more the mercury, if your mercury content in the amalgam when you are mixing, if it is more, so there will be formation of more gamma 1 phases, more gamma 2 phases, means all the phases are there continuously forming if there is a more mercury, because once the mercury is get consumed in the formation of this, there is no formation of these phases, the formation of the phases stop. But if there is a mercury is present in your mix, so it will continue to form and it will decreases the strength. So there is a one technique is evolved that is known as minimal mercury technique, where it is invented by W. Imes. That's why it is known as Imes technique also. So here he has used minimally, means mercury should be used minimally. According to him, the recommended ratio is 1:1 mercury alloy ratio for high copper, and for low copper it is 40:60. So because of this, there is a very less amount of mercury is used while trituration. Now next factor is the particle size. As the diameter of the particle sizes are smaller, there will be increased strength as compared to the bigger particle size. Now the next factor is the trituration. Now how trituration will effective? Now trituration, it depends on the different types of the amalgam alloy, whether you are using lead cut, spherical. So according to that, you will have to apply the trituration time, energy, speed. This will be different. Both under and over trituration will decreases the strength. Now how this will occur? Means if your trituration energy is optimum, so what will happen? It will cause even distribution of the matrix over the amalgam result. Amalgam mix means it will cause a even distribution of the matrix will occur over the amalgam mix, and it results in a improved strength in your restoration. But if the trituration is continued even after the formation of the matrix, there is a development of crack, and there will be subsequent drop in the strength of the set amalgam occur. So your trituration should be optimum. It should not be under, it should not be over. In either the case, it will decreases the strength. Now the next factor is your condensation pressure. Now larger the condensation pressure, it will cause better adaptation of the restorative material. There will be good cohesion, and it will increase the strength. Larger condensation also expresses out the excess mercury, and because of this removal, there is a decrease in the formation of the voids, which will ultimately result in the higher strength. But you just kept in mind that when you are using a spherical type of alloy, the condensation pressure applied should be less, as because of the spherical shape, the condenser may pierce into it because of the higher condensation pressure. So according to the material, according to the type of the amalgam alloy, you will have to apply all these features. Now this is a very good table which is telling you everything about the compressive strength and tensile strength, compressive strength of 1 hour and 7 days compressive strength. Now here if you compare, the single compositional alloy is having the highest 1 hour and highest 7 days compressive strength. After that there is admix, and after that there is a conventional. And about tensile strength, it is approximately between 55 to 62. So the material is weak in thin sections, and unsupported edges of the amalgam are fractures under the occlusal load. Due to this brittleness, adequate support from the surrounding structures are required. In case of class 1, yes, the cavity is surrounded by the whole tube, but in case of the class 2 or class 1 compound, you will have to take a support of the matrix bands so that they support the restoration, and after the setting of the amalgam, you remove the bands. So this is very, very important to take the support from the surrounding structures. Now the next property is the dimensional changes. Now, whenever you mix a mercury with the amalgam, it undergoes both the changes. Either both changes means expansion is also there and contraction is also there. So we will see these dimensional changes in two phases, in two stages, that is stage 1 and stage 2. In stage 1 there is a contraction, and in stage 2 there is an expansion. Now how this contraction occur? Once you start mixing amalgam alloy with the mercury, after the 20 minutes there is a starting of initial contraction. Now this contraction results as the alloy particles dissolves in the mercury, and there is a formation of gamma phases. Now these gamma phases start to form, and they start to grow. Now this contraction continues as long as there is a growth of the gamma 1 phases occurs. Now as the gamma 1 crystals grow, they start to impinge on each other, and they causes outward pressure. And because of this outward pressure, they counteract the initial contraction, and there is a expansion occurs. Now this expansion occurs when there is adequate liquid mercury is present. If the mercury is not present, the expansion will stop. So it is said that the mercury should be less, so the expansion will not be more. And after this, once the this adequate mercury is present, and after that the material get hardened, it becomes rigid matrix, and the expansion get stopped. Okay. Now, what are the factors that affect the dimensional change? As we have seen the factors affecting the strength, there are different factors which affect the dimensional change also. Here also there is particle size, particle shape, mercury content, trituration, condensation pressure, and one more thing is added here is your moisture contamination. Now let us see one by one. Now the first one is a particle size. If the particle size is smaller, the surface area will be more. The stage wind will come fast. There is a formation of more gamma 1 phases will form. They will start to grow fast. They start to impinge on each other. They start to giving outer pressure to one another, and there is a starting of the stage 2 will occur very fast. So there is no expansion. So your particle size should be small. Next is a particle shape. More regular, more smooth the particle surface. Mercury wet the particles very nicely, more effectively. The amalgamation reaction occur very fast, so there will be no expansion. So your particle shape should be smooth, regular. Now the next factor is the mercury. Now I think you must have been understood. More mercury, continuously more crystal growth, more gamma 1, gamma 2 continuously forming. Stage 2 will be prolonged because there is a mercury, so the particles are growing very nicely. So stage 2 will be very prolonged, and there will be expansion. Ultimately the expansion will occur. Now the trituration. More the trituration energy you are applying, particles and the particles because of the trituration energy, the particle size will become smaller. So because of that, mercury will get very nicely pushed between the particles, so there will be no expansion. Now the next factor is the condensation pressure. More the condensation pressure is applied, particles will become closer to each other, the mercury will be expressed out, and there will be more contraction. So condensation pressure should be applied properly. Okay. Now the moisture contamination. Ideally, all the silver amalgam, means the normal mixed silver amalgam, they show minimal dimensional change after the 24 hours. That is acceptable. But if the amalgam mix get contaminated by the moisture during the manipulation, it is known as delayed or a secondary expansion. So most commonly asked short answer question is delayed expansion. Most commonly asked, so I am taking it in a detail. So delayed expansion is also known as secondary expansion. Either zinc containing either low copper or high copper amalgam, if it is get contaminated by moisture during the manipulation, the expansion that occurs after a few days and it continues for a month is known as delayed expansion. And this moisture contamination should occur during the condensation or the trituration procedure. If it is happen afterwards, then there will be no delayed expansion occur. But if this is happening during this procedure, condensation or trituration, now the contamination either from your hands, the operator hand, or with the saliva or the air water syringe that is present in the chair, dental chair, if it is that we use to dry the tooth cavity, if it is contaminated by that water also, then this delayed expansion can occur. And this setting expansion is very big, it is very large, that is about 400 microns, which is about 4%. Ideally, according to the ADS specification number 1, 20 micron is permissible expansion, but this is, you can see where 20 microns and where is a 400 microns. It is very large setting expansion. Now how this occurs? In this, the zinc react with the water, that is moisture contamination, and there is a formation of zinc oxide plus hydrogen gas, and this hydrogen gas remains in the restoration, and this gas gradually exert internal pressure in the cavity in the restoration. Because of that, it causes expansion after the few days. Now what is the clinical significance? There is a protrusion of the entire restoration occurs. Means patient may give you complaint, my tooth is looking, I feel that my tooth is I'm feeling that my tooth is little bit at a higher level at compared to the other tooth. That is in a hyper occlusion. That is a protrusion of the restoration. There will be increased microleakage because of the restoration get protruded out. So there will be a microleakage, means there will be a gap between the tooth and your restoration. Restoration may get perforate. There will be increased creep and flow. There will be severe pain to the patient because it is exerting pressure in the cavity. Because of the creep and flow, there is a fracture of the thin cavity walls. So how you can prevent? First of all, you will have to prevent the moisture contamination. Preferably use non-zinc containing alloys and use rubber dam while restoring the cavity. This is the best way. I hope you must have seen the rubber dam. So this is a sheet of rubber dam which is placed in the oral cavity, which here only the tooth which want to be restored is visible, the rest of the area is covered. So this is best way to prevent the moisture contamination, also safe for the patient or the operator by of the saliva contamination and the other infectious diseases that get spread out by the saliva. Now the factors which increases the setting expansion. Higher the mercury to alloy ratio. If mercury is more, the expansion will be more. Larger alloy particle size, yes, particle size should be smaller. Slow mixing speed, your energy, trituration energy should be high. Prolonged trituration, yes, both under and over trituration will causes the expansion. Low condensation pressure, moisture contamination that we have seen in detail and delayed expansion. So that are all the factors which increases the setting expansion. Now the clinical significance of dimensional change. According to the ADA specification number 1, the dimensional change, either contraction or expansion, 20 microns is permissible. It is permissible. We have seen in delayed expansion, it is around 400 microns. Delayed expansion occurs at 400 microns. There is a expansion occurs. In case of setting expansion, if it is small, it is acceptable. And it is acceptable means it causes better sealing. Means if it is expanding, there is a better sealing occurs between the tooth margin and the restorative material. So it is good if it is expanding. But it is if it is excessive, means if it is acceptable when it is small. But when it is excessive, it causes pulp injury, it causes hyperocclusion, it causes ultimately fracture of the restoration that we are seeing in the case of delayed expansion. Now what about the contraction? In contraction means what? The restoration has become shrinked out. It becomes shrink, and because of the shrinkage of the restoration, there will be a gap in between the tooth and the restorative material. So that is known as, that is a microleakage. And because of the microleakage, if patient is not taking care, if there is a microleakage occurs, there is a development of secondary caries, because in this gap there is a food lodgement occurs, and again there is a development of caries that is known as secondary caries. Now if this microleakage is enhanced, what will happen? There is one terminology is known as percolation. This can be a MCQ question. So this percolation occurs, this is a microleakage only, and this also occurs because of the mismatch of the coefficient of thermal expansion between the tooth enamel and the restoration. Now if you see here, the coefficient of thermal expansion of tooth enamel is 11.4 ppm per degree Celsius, while that of silver amalgam it is about 25 ppm per ppm per degree Celsius. Now here this you can see it is almost more than double of the silver amalgam tooth enamel. So if because of these differences also there is a microleakage occurs. So this is a development of secondary case. You can see here, because the microleakage, you can see all this blackish area. These are all developed secondary caries. So what is microleakage? The penetration of the oral fluids through the marginal gaps between the restoration and the tooth wall is known as microleakage or marginal leakage. What are the causes? High coefficient of thermal expansion of the amalgam. Yes, it is. Vast differences there. Contraction of the amalgam during the hardening, marginal breakdown. All are the different causes for the microleakage. So how will you prevent the microleakage? Apply cavity varnishes to seal the exposed dentin. Use amalgam bond. There is a now in the market amalgam bonds are available like dentin bonding agent. So they are there very nicely to the amalgam restoration are there nicely to the tooth, so it doesn't get contracted. Initial corrosion products that is formed, the sulfides that is formed at the margins of the amalgam restoration, they seal the margins automatically. Select the amalgam having the least dimensional changes and condense the amalgam carefully. So all are the remedies to prevent the microleakage. Now lastly, I will be covering mercuroscopic expansion. Now this mercuroscopic expansion, at one time it has been asked in a short answer question of the university exam. So what is this? Inhomogeneous condensation pressure and wrong burnishing technique pushes the mercury rich thin mix to the margins of the cavity. So because of this, at the margins all the mercury get collected. These margins have high mercury content, and this mercury, they react slowly with the alloy and produces more weaker phases, causing the large setting expansion at the margins. and which lead to the formation of thin ledges at the margins, and it leads to fractures. So this is known as ditched restoration. If it is fractured at the margins, it is known as ditched restoration. This is all happened because of having the excess mercury at the margins. Now the expected questions on the today's topic is most commonly asked short answer question is delayed expansion, Mercuroscopic expansion, factors increasing the setting expansion or strength of the silver amalgam. So students, this is all for today's part 3 lecture. In the part 4, we will be dealing with the rest of the properties of the silver amalgam. Thank you. Goodbye.